Welcome friends for this talk on the role of tocotrienols and vitamins in muscle cramps. I am Dr. Ram Prabhu, a senior orthopedic surgeon practicing in Mumbai for the last 42 years. I have been past president of Indian Orthopedic Association and Bombay Orthopedic Society twice, and also have been a senior vice president in APOA, Asia Pacific Orthopedic Association. So it gives me a great pleasure to welcome you all for this talk. Today the topic of the talk is role of tocotrienols and vitamins in reducing and preventing muscle cramps. So we know that the muscle cramps are extremely common and they are continuous, involuntary, painful, localized, and it is a contraction of the entire muscle group or individual single muscles or select muscle fibers. It's a loss or damage to lower motor neuron is very evident, which is associated with the cramps. It's a chemical mediator such as prostaglandins, lactic acid are released and they cause pain. The prevalence of muscle cramps in general population is extremely high. We know that 37% of overall annual incidence in healthy adults is present. At the same time, 30 to 50% of lifetime prevalence in athletes and elderly above the age of 65 years. And we also know that 76% of type 2 diabetes mellitus suffer from cramps. So there are various different types of muscle cramps which are prevalent. We know there are true cramps, there are contractures, there are tetany, and there are dystonia. In true cramps, we have motor unit hypersensitivity and hyperactivity. We have ordinary cramps, hemodialysis induced cramps, heat cramps, fluid and electrolyte disorder cramps, and hypoglycemia cramps which are present. And in contractures, we have electrically silent cramps which are metabolic myopathy, McArdle's disease, and thyroid disease. And in tetany, we know that it is sensory and motor unit hyperactivity which is present, which is because of hypocalcemia, respiratory alkalosis, hypomagnesemia, and hypoglycemia which is present, which is also because of hyperkalemia. And then there is the dystonia, which is simultaneous contraction of agonist and antagonist muscles, and which are occupational cramps. We know there are plenty of causes of muscle cramps. First and foremost is overuse of these muscles which can cause cramps. We know this in the day-to-day of practice. And dehydration, which is again very important cause of cramps. We know lack of water can cause cramps in anybody, whether it's athletes or old people. We know muscle strain and also can cause cramps, and also holding a position for a prolonged period of time also can cause cramps. Now these can be due to long drives or again sleeping, they can cause cramps. So these are also called as the nocturnal leg cramps, where people can have cramps during sleep. Inadequate blood supply is again another way or cause of a cramp, which is again very commonly seen. Pregnancy, especially second and third trimester, can cause cramps, and exercise related. We know lots of people who are gym going can have cramps suddenly during exercises. Then we know that there are plenty of risk factors. There are general risk factors like age, dehydration, pregnancy, risk factors for exercise associated muscle cramps. Family history of cramping is also there, which is very unusual, but we can see that in families. Previous occurrence of cramps during or after exercise is very common, and increased exercise intensity and duration. Some people suddenly while weightlifting can get cramps in lower limbs and upper limbs. And tocotrienols can help in these cramps. We know circulatory disturbance and increased oxygen demands are probably important factors in muscle cramps and muscle spasms. Tocotrienols or vitamin E facilitates oxygen use in normal metabolic process through its relationship with certain enzymes by its antioxidant effects. Vitamin E prevents the production of prostaglandins, thus reducing muscle contractions and pain. The frequency of muscle cramps decreased significantly during vitamin E therapy, and at the end of the trial, vitamin E led to cramp reduction in almost 69% of the cases. Tocotrienols or vitamin E of 21st century is very important and very different from tocopherols that has been used in the past. These have 40 to 60 times more potent antioxidant properties than alpha tocopherols, and that is seen and that has been researched. It demonstrates analgesics and anti-inflammatory properties, and it reduces pain and discomfort and prevents muscle spasm and improves muscle health, which is very important differentiation from tocopherol. There is also wheat germ oil, which is very important ingredient, which has demonstrated antioxidant and anti-inflammatory properties. It reduces inflammation by decreasing the level of prostaglandins. Vitamin E, B and D, magnesium and calcium are very crucial compounds found in wheat germ that can significantly elevate smooth muscle contractions. It activates neuropeptides, cytokines, and thus reduces muscle contraction and pain. So this is very important property of a wheat germ oil. And then we have cod liver oil, which has been given in the past and even now, which has omega-3 fatty acid, which contains EPA and DHA, which is very important ingredient of it. Omega-3 fatty acid shows anti-inflammatory effect by reducing the production of inflammatory cytokines and cytokines. EPA and DHA act on pathway involving cytoscox and LOX, and this is very important pathway which inhibits TNF alpha production, leading to decreased response to pain. Vitamin B6, again pyridoxine, which is very important, and folic acid. Vitamin B9 is important for reducing or preventing the muscle cramps. Vitamin B6 and B9 reduces prostaglandin levels, PGE2, and pain intensity in cramps. It leads to treatment with vitamin D complex significantly reduced, and frequency and intensity and duration of nocturnal leg cramps is reduced considerably. So we have various case studies which I can show you about. In case number 1, there is a 55-year-old lady with controlled diabetes and hypertension on anti-diabetics and antihypertensive drugs. She complained severe leg cramps frequently during the day and in night, and onset at 3 a.m. in calf area, which was very commonly seen in her. It increased more frequently from once to 2 to 3 times a week. Clinical and radiological findings where we showed that the serum electrolyte level, the calcium, the vitamin D, sodium, potassium, B2 levels were all normal except low levels of calcium and vitamin D. And then started and continued on anti-diabetics, antihypertensives along with vitamin D and calcium. And vitamin E, that is tocotrienol and cod liver oil combination, was also prescribed. It gave rise to significant reduction in the frequency of cramps, and intensity of pain to once in the fortnight or month was observed. In discussion, we have vitamin E, cod liver oil, which should be recommended in the initial treatment of choice for muscle cramps. In the case 2, we have a 40-year-old lady who has previously experienced occasional muscle cramps throughout her life, currently experiencing consistent calf cramps after long runs every 2 days while training for a half marathon, which is 21 kilometers, and with excessive sweating. Also complains of infrequent bedtime calf cramps once in every 3 months for a brief duration. The findings clinically and radiologically, we saw that the screening laboratory work included complete blood count, creatinine kinase and extended electrolytes. Renal function assessed by creatinine urinalysis and vitamin B12, B6 and D levels, blood sugar, hemograms, etc. were tested. All these results were normal. The nerve conduction and EMG was normal without evidence of neurogenic or myopathic abnormalities. So diagnosis of excessive salt loss through sweating is thought to be the reason for these exercise-induced cramps. What we did was the patient was reassured that the infrequent muscle cramps are not due to insignificant medical or neurological conditions. Counseling was given on vitamin E, tocotrienols, wheat germ oil, cod liver oil, vitamin B6 and B9. Stretching of the calves before bed was advised to minimize the occurrence of infrequent cramps. Salt tablets and aggressive hydration during races help to minimize these cramps and allow participation in races without limitation. So in discussion, we have muscle cramps as a symptom which are ubiquitous throughout the lifespan, starting usually after the age of 8, increasing in the prevalence with the advancing age. Stretching before bed and supplements like vitamin E, B, cod liver oil and wheat germ oil can help reduce the frequency of idiopathic and benign muscle cramps. So we have power of 5, or we have 5 things which reduce the muscle contraction, inflammation and pain. Tocotrienols, which reduces the oxidative stress, smooth muscle contraction and pain is also reduced. The wheat germ oil activates macrophages, neuropeptides and cytokinase and decreases the prostaglandin synthesis. Anti-inflammatory effect also is there. The cod liver oil, the EPA and the DHA benefit are seen, the anti-inflammatory effects are seen because of that, and vitamin B6 and folic acid reduces the PGE2 and reduces the pain intensity. So in summary, the muscle cramps is uncontrollable twitch or painful spasm that results in an involuntary contraction of a muscle. Prevalence of muscle cramps is high in general population. Tocotrienols and their antioxidant and anti-inflammatory effect can be incorporated into the management of muscle cramp, which is seen. Addition of wheat germ oil, cod liver oil, vitamin B6, folic acid gives an added benefit in reducing muscle contraction, pain and intensity. So friends, this is an advantage of tocotrienols along with wheat germ oil. Vitamin B6 and vitamin B9 are very important for this, helping these muscle cramp patients. This could be given for 3 months or 6 months, which could help in the long run the muscle cramp patients, and they will really be very happy that their cramps are controlled. Thank you very much.